Oh, it was recorded. Okay, perfect. So online, we'd like to welcome Dr. Meabh Bhuinneain. She's consultant obstetrician and gynecologist in Mayo University Hospital, and she's from the partnership between the Institute of Obstetricians and Gynecologists in the Royal College of Physicians of Ireland and East Central and Southern Africa College of Obstetrics and Gynae. The focus of this partnership is the promotion of excellence in specialist medical training in reproductive healthcare in both the East, Central and Southern Africa region and in the Republic of Ireland. Dr. Bhuinneain is a consultant of Gynae Mayo University Hospital since 2001. She holds dual specialist registration in obstetrics and gynecology and general practice following training in Ireland and Melbourne. She's led the partnership between Brighter Communities and management teams of Lordani Sub-County and Mayo University's Hospital since inception in 2007 to date. And today Meabh will share with us about the development of the new partnership between the Institute of Obstetricians and Gynecologists, the RCPI, and the East Central and Southern Africa. So I'd like to welcome you, Meabh, and we'll just hand over to you there. So thank you.
Thank you very much. Thank you for the welcome. And just to clarify, I've actually finished up now in Mayo University Hospital, but our link is being led on by Eddie Conran. And hopefully we have a little team travelling shortly, and we will be paying back our carbon debt. So if I could introduce Judith Andrew, who's also online, who is the programme coordinator in the East Central Southern African College of Obstetricians and Gynecologists. Perhaps we can call that EXACOG for the duration of this chat. I don't know if Judith's picture can go up. Probably we're on the ticker down the bottom at this point, but there's Judith on the ticker tape at the bottom. Hello, Judith, and thank you for joining us.
Welcome, Stuart.
And I got the straw for doing the verbal presentation, but Judith has contributed to the slides and a lot of the content. So thank you for coming back so promptly after lunch. We're delighted to have this opportunity to talk about a new partnership, but we're also delighted to attend this particular partnership meeting over these 7 years, because we go away with little gems every time, whether it's a phrase that data really counts, or grab your allies, make an alliance, you'll have greater leverage, as we see Dr. Firth's group doing for the NCDs. Learn the architecture of partnerships, and that's certainly what we're doing today, and use frontline knowledge, use the knowledge that's there on the ground, use it in the improvement cycle. So all of that leads us now to talk about a new partnership under the umbrella of, will it be a sustainable health partnership? And we certainly hope that it will be. Is that okay? So I'll take the next slide, please. My connection says good, but I'm not seeing the slides going forward. Can you hear me okay?
Yes, we can hear you. I think it's maybe in the venue. I'm checking with them now online.
Thank you.
I think it's the connection maybe in the venue, because I can hear you very well.
Okay, we'll give them a moment.
Sorry for this.
No problem.
As always. Everyone online, can you hear Meabh well? Yes.
Thank you.
Thank you.
Yes, we can hear.
Perfect. Thank you.
And it worked beautifully this morning,
Huh?
the conference room. It worked well in the
Yeah.
room this morning.
I think it's, yeah.
So we're back, Hala, now. Sorry to interrupt you. Sorry, Meabh, because we dropped off there for a while.
No worries at
No
all.
problem.
No worries. Thanks.
Okay,
Are we good again? Sorry, Meabh, about that. It was the technical.
no problem. No problem. Thank you.
Yeah, thank you.
So I'll take the second slide and go on to the discussion of the context. So why we're setting up a postgraduate training partnership at this point in time. So in the background over the last 20 years, this ESTHER group of partners is very familiar with the great work that's been done with COSEXA, the College of Surgeons, and CONEXA, the College of Anaesthetists in East and Central Southern Africa, facilitated by the RCSI and the College of Anaesthetists in Ireland. And we also have seen the strength of the HSE Global Health Programme, using quality improvement cycles, diversifying its global health education, structuring ESTHER and facilitating Irish aid assistance. And we also see our training bodies grouping together and learning more about global health and trying to make global health more mainstream. So from a top-down approach, if you like, we can see that there's lots of activity, has been very forward progressing in the last couple of decades. And in the Institute of Obstetricians and Gynecologists, we've not had a formal response to that until this time. However, many members of the Institute of Obstetricians have travelled with Brighter Communities, and Maria Kidney from Brighter Communities is online with us today, to a community development project in Lundiani, and the Mayo Lundiani Hospital Partnership grew out of that. And the obstetricians who went, many of them came back and to learn more about community development and to understand why maternal survival was such a challenge in this community. And as the community sensitization, education, activation occurred, and as the ministry facilitated the shift towards facility birth, certainly some of the indicators really improved. But at the end of the day, there was still no specialist provision in the district hospitals and in many district hospitals of the area. The surgeon doing the operations is not a trained surgeon. The anaesthetist doing the anesthesia was a clinical officer in anesthesia. And there were no obstetricians in the immediate area where we were visiting. And over the first 10 years of our link there, only one local doctor trained as an obstetrician gynecologist was bonded into ministry service and was posted elsewhere, a good few hundred kilometres away from Lundiani, where there was a priority need. So it made us reflect on how doctors are trained in the area and the loss of doctors internally in some countries to the private sector, to the NGO sector, and to public and population health. Not saying that that's not a good option, but we also want to try and keep some clinicians on the floor. I'm obviously from a clinical background, I apologise. So I'll take the next slide, please. There are other challenges in global obstetrics in that to deliver the Nairobi Summit goals for women's health. I'm still seeing the third slide. Can I have the next slide? Or am I out of sync? Yeah, thank you very much. So to deliver the commitments that our minister signed up for in 2019, and that was alluded to this morning by Anne Holmes from Irish Aid, we need some specialists. Most of this work can be done through societal change and civil society groups, and through midwifery, through nursing, and through other population health measures. But you do need a few specialists scattered around in certain locations. And in global surgery, which is getting some traction, like the NCDs as a current major forgotten burden of disease, about 40% of the surgical provision is obstetric in nature and emergency gynecology. And there are infrastructure, supply, leadership problems. And gynecology really doesn't get a mention at all until we discovered that cervical cancer was preventable through vaccination programs. So a lot of silent burden of disease going on when there's no gynecologist to provide the complex care. So never mind the emergency work, there's a lot of other work that a specialist in obstetrics and gynecology can provide. Next slide, please. Ideally, we would have 40 surgeons, anaesthetists and obstetricians per 100,000, providing about 5,000 procedures for the population. So there are measures there, there's metrics there, and to know what impact we're making. But like many of the health inequality, where there are the largest numbers of needs or births or procedures required, there are often the lowest density of trained staff to provide that. Safety in surgery is proven where there's a certain volume by a certain level of training. It doesn't always have to be a specialist surgeon. It can be a clinical officer who's trained in surgery. It can be a physician assistant. It can be a technical theatre operator. But the supervision and training and auditing should be led and directed through specialist surgeons. So to know what workforce strengthening is necessary both in Ireland and in EXTHER, we do need to map the workforce. And now in Ireland, as a tiny country with a small population, with a significant number of births, we have a programme that can do that work, and we've struggled to fill our posts. We have funded posts that are lying empty. EXTHER doesn't as yet know its mapping of OBS and gynae workforce, and that is one of the first projects that this partnership has already started. I'll take the next slide, please. These slides went in before the first talk this morning, but the obstetrician has a role in sexual reproductive health values and rights as well. And in our own 10 years of values and rights discussions in Ireland in reproductive health measures, and the Institute was working away with government committees and with different policy work to ensure that we can move from a country of unsafe abortion to a country of safer abortion, that we can make sure that there's contraceptives available, although that didn't come in the legislation, and it continues to be a challenge for many who don't have the ability to cost share. Next slide, please. So that context and background is a little bit long today, but it's because it's a new partnership. I just wanted to give you the scene for why specialists might be helpful in some of the population health measures that we're addressing. And EXACOG has a very clear vision, mission, and membership to really move along the indicators for reproductive, maternal, and newborn health in their region and beyond, to be influencers, leaders, and to be able to direct policy in their region. And the Institute has been established for over 50 years and comes under the umbrella of the RCPI in Ireland, comes under physicians, even though we're classified as surgeons internationally, and has a very established training program and continues to have huge investment in its training program from our government services. Next slide, please. So we found common ground, and in any match for partnership, we had to make sure we had common ground that we would, as partners, both gain from collaborating together, looking at innovation that would help the Irish health system, looking at training solutions that may or may not be useful in the EXTHER region, but just that collaboration, becomes. I just see a note coming through. Oh, thank you. Just that collaboration brings a certain amount of creativity and problem solving that we don't get if we stay in our own systems within our own institutions. So we have identified common ground in trainers and training sites and logbooks and development manuals and continuing lifelong learning. Next slide, please. So we brought, Judith did significant work with her secretariat, and we have a picture here from the Institute, the RCPI, with obstetricians, assisted by a visit from the College of Surgeons in the EXTHER region, and from our own Institute of Global Surgery and the RCSI, who've been incredibly facilitative, supporting, leading, nudging, coaching us through this process. And particularly Eric O'Flynn over the years and Lucia Procato more recently. And our two organisations agreed in March of this year. They met, they introduced each other, they shared vision and agreed to work together, and went away from the table and from the Zoom call and worked on the Memorandum of Understanding, which has gone back to both executive councils and has been accepted for signing. There's been a couple of changes in chairs and presidents and governance that is just taking us a little longer to get through the hoops of a new governance structure within the RCPI, but we're hopeful that it will be over the line fairly soon. Can we have the next slide, please? And meanwhile, while this is going on, we're establishing the principles of partnership and making sure that we have a fit in both institutions. We're using the startup grant that we're very grateful to receive for a face-to-face visit at this time, which is like the gestation of an elephant calf, about 22 months, I think, since Judith and I started talking to each other. So it looks like we'll have the first birth in Zimbabwe by the looks of things, because Judith has proposed that we visit during a regional conference, as it's an easier time to meet face-to-face. And we've decided that our team would actually include a trainee to visit. So from the outset, we have the Junior Obs and Gynae Society, which is very active in Ireland, of obstetric trainees, sent out a call for expression of interest. There was a lot of interest, and the commitment is that this trainee would visit and then agree to work with the working group for the next year to contribute to a trainee-led opinion on the programme from the beginning. And Judith has set up and introduced us to a hospital that we can visit in Western Kenya, as we have the other link work continuing as well, to visit the first training site. And the first trainees are just starting this month, 5 years after EXACOG was founded. And it's very exciting and great success for the programme that they are recruiting their trainees at this time. Next slide, please. During our visit, we will check in with the embassy, as we Brighter Communities have forged links there that will allow us to let them know what we're doing in the region. And we also like the community visit when any partners are visiting or any study tours are occurring, just to be able to firsthand hear the patient experience, to have that community voice. So we hope to be able to hear from not just from the specialist side of things, but also from the communities on our visit. And we will attend a scientific meeting as well as the partner meeting. And I think a couple of abstracts have gone into that. Next slide, please. Nearly there. The surgeons and anaesthetists have done great work on mapping their workforce and planning and knowing what the trends and demographics are like, to try and address that urban drift that we all have in healthcare, and to address where the subnational data suggests that there are greater needs than the national data might suggest. So there's wonderful data out there, and the Institute of Global Surgery and the RCSI are wonderful leaders in this field, and very much have moved on at such a great pace. I just hope that I know the EXACOG will be able to keep up, because Judith has already worked with the COSEXA programme. I just hope the Institute in Ireland will be able to keep up as well, because the RCSI has certainly been driving that the development with COSEXA over these years. Next slide, please. So we have a cycle of work, and we're proposing a 3-year cycle, and the identified needs have been the e-portfolio, country engagement, because not all countries are able to engage or have capacity to engage. And if we're to think of the Irish Aid approach of furthest behind first, then those countries that have not yet got master trainers, that have not yet got accredited hospitals, should probably be our first focus, if that's what all partners would agree on. However, the training and methods and exams and logbooks do have to be piloted in the region and made sure that they're fit for purpose. So the countries that have trainees, Kenya, Rwanda and Zambia, will be forging ahead at this time. There is a research group already established across RCSI, COSEXA and the two obstetric partners, and already there is a team doing the baseline data and meeting with the stakeholders, the medical councils and the professional societies in all the country organisations to have permission to access secondary data on their obstetricians, so that the obstetricians can be contacted directly. And that will give some idea for measurement for what will probably be quite a long project, as maybe the gestation of 3 elephant calves, as they have a little bit of secondary infertility after the first calf. They tend not to have their second calf for 4 or 5 years. So I suspect that we might have some similar gestational problems as obstetricians. Next slide, please. So that's all that I have to say, unless Judith would like to come in with anything at this time. But we are really grateful for our enablers and facilitators, David and his team, in pushing us to become more active in this realm, and Eric, Lucia and his team for pushing this from across the Stephen's Green, and then for Judith and her team and for her consistency over this time. And all this started up during COVID because we had nothing else to do.
Thank you very much, Meabh. I hope you have covered what we had intended to present in this forum, and I'm very excited to join this forum for the first time. I've learned a lot in the morning sessions, especially on the fundraising. So thank you very much to everyone, and we look forward to collaborating with ESTHER and other partners.
Brilliant. Thank you, Judith. That's great. And thank you very much to Meabh. That was a fantastic presentation. That's done, yeah, brilliant. All your slides are finished, Meabh. Yeah, that's it. Brilliant. So does anyone have any questions from the floor, just in terms of the presentation of just visions of these elephant calves running around it? But it's great to see the progress of the work and the excitement of getting the trainees on board now, you know, at that point. So congratulations to everyone involved. Is there any particular questions that anyone has on the floor just before we move on to David?
Well, if I could just make a comment on this, based on the RCSI experience with surgeons.
Can you speak? Can you hear? Meabh, can you hear? Yeah, brilliant.
Yeah, I think the collaboration, the work of COSEXA, the College of Surgery Centre of Southern Africa, has transformed the landscape of surgical training in Africa. And the huge change from people leaving Africa to do their surgical training to now being trained on the continent. Yeah. That's transformational. And the collaboration with RCSI has been very instrumental in some of the changes that have taken place. And I see a similar potential with this collaboration. This is going to address similar issues within the area of obstetric care. And it ties in very much too with the Irish Aid priority, sexual and reproductive health. And so I think this is a very exciting development. I think it's very timely, and I think it's huge opportunity and potential. And I wish you well, Meabh and Judith.
Yeah.
I hope the gestation doesn't take quite as long.
Yeah, well done. Anyone else? And is it from your experience from the college?
As a program, so thank you so much to Irish Aid also that supported the collaboration program for more than 15 years.
Excuse me, we can't hear you very well. Sorry.
So say thanks to Irish Aid support that supported the COSEXA and RCSI for over 15 years. And we are pleased to facilitate the collaboration of the two colleges. I'm very pleased to see Judith participating today, and you could also share the European network. This is very important as we exchange information and experience. And I'm here to still facilitate this partnership and cooperation. So anything you need, please give us a shout.
Brilliant, that's great. Thank you very much. Thank you very much, Meabh, and to Judith. It was a fantastic presentation. Okay, so